Welcome back, everyone. Lorina Zenz-King is with us from Lima Memorial. She's a nurse practitioner there. We're talking a little bit about wellness visits. We're all guilty of not doing those as much as we should. But first of all, if you could explain what that is.
Well, a wellness visit is just that. It's well. We want it to keep you well. So we have you come in, do your routine blood work. We do mammograms, pap smears for women, do prostate and blood work for men. We also go over things like diet, exercise, sleep habits, what the stress is in your life, depression and anxiety screenings. Really, we are trying to keep you well. So most cancer screenings, even colonoscopies and things, early detection, survival rates are very high. So we're just trying to keep you well.
Yeah, boy, that's such a good point because many of us are so guilty of not going to a doctor or nurse until something is wrong. But as you said, what we're talking about here with the wellness visit, that's a very good thing that can cut off some big problems down the road.
Absolutely.
Yeah, you know, the other thing you talked about, too, is trying to prepare someone for it, what to expect. Give us a sense if someone comes in for a wellness visit, what kind of things that they go through.
The first thing I would really advise is be aware of when you've had your last screenings. Women, when have you had your last mammogram? When have you had your last pap smear? When's the last time you've had some routine blood work done? Immunizations are a big thing too, especially with COVID out here. You know, we talk about flu and pneumonia, shingles vaccines. Know when you've had all of those the things the last time, so that we're more prepared to know if it's time for you to have those things done.
Yeah, you know, it's a good point because I hear, especially shingles made me think of it. I know there's a certain age when you talk about getting that vaccine and certain things. Is that one thing you can do is say, hey, this is an age range where you might want to start thinking about these kind of things?
Correct. And depending on your age, 65 and older is usually the age when we really start to worry about those bigger vaccines. Some insurance companies are allowing us to do shingles as early as 55 now. So absolutely based off your age, and we even do wellness for children too. So based off your age is when we start to do certain screenings.
Yeah, you know, the other thing we brought up too was your health insurance and that kind of thing. I know a lot of times that we go and get these wellness visits, that helps with our deductibles and our premiums there. For those who might be interested in getting a wellness visit with you guys, what's the process they need to go through?
Simply call the office. We have our 800 number, simply call that. And if you're not an established patient, we can get you established with a provider that's accepting new patients. If you are established, of course, we'll just get you scheduled in with your primary care provider and a convenient time for you, and we'll go from there.
Simple as that. Lorina, thank you so much for telling us about it. We appreciate it.
No problem.
Nice talking with you, and we'll be back right after this.